Hello, friends. I'm your host, Sharath, and today we're going to that is American Association of Physicians of Indian Origin. Today's discussion will be about the upcoming events and new projects of American Association of Physicians of Indian Origin and what are their plans, initiatives, and wonderful ideas. The topic for today is called Past, Present, and Future of AAPI. So let's welcome our wonderful guests and panel members, Dr. Anupama Gottimukula and Dr. Ravi Kolli. Let me introduce them. Dr. Anupama Gottimukula is a pediatric anesthesiologist and an alumni of Kakatiya Medical College. She also did residency at University of Miami and have taken fellowship training at University of Michigan. Dr. Ravi Kolli is a psychiatrist with 30 years of experience and also a board-certified general psychiatrist in addiction, geriatric, and forensic psychiatry. So let's welcome our wonderful guests, Dr. Anupama and Dr. Ravi Kolli. Dr. Anupama and Ravi Kolli, welcome to our show. How are you doing today?
Thank you, Sharath, and we are doing great.
Thank you. I'm doing great, Sharath. Thank you.
Thank you, Dr. Anupama and Dr. Ravi Kolli. It's a pleasure having you both. Very much excited to talk about the prospects of AAPI and all the things that are going to happen in 2022 and later. As you know, friends, Dr. Anupama Gottimukula is the current president of AAPI, and Dr. Ravi Kolli is the incoming president of AAPI. So let's find out more about AAPI as well and other prospects. So I'll start with you, Dr. Anupama. Please, break the ice. Tell us about AAPI and what AAPI is.
So AAPI is American Association of Physicians of Indian Origin. And this is the largest ethnic organization in the United States. And it's all volunteer physicians who serve the AAPI organization. And interestingly, this is the 40th year of AAPI formation. It formed in 1982 by a handful of physicians in Michigan because they were having some racial issues and racial discrimination issues. So then they thought that we should have our own voice and organization for us. That's how the AAPI organization formed in Michigan. And now we are almost 40 years old. And now we have almost about more than, I would say, 100,000 physicians are working in this country. And we serve every rural area in this country, you name it, you will see an Indian physician. And Indian physicians are almost 10% of workforce as per the AMA. And so we work in rural areas, academic centers, and private practice. 65% are all in primary care, but rest are all specialty care as well. So Indian physicians came here and achieved a lot. This is the cream of India who came here, and we are still growing and growing every year. And so we also have 15 to 20,000 medical students and fellows of Indian origin. Almost in a class like medical class here, we have almost 10% are of Indian origin kids. So AAPI is the physicians organization, and we serve the needs of our physicians. We are the voice for this for the physicians of Indian origin in this country. So we are well connected to AMA, that's the American Medical Association, and other organizations as well. So we have several activities, but we can go over later.
What a wonderful introduction, Dr. Anupama. It was very much enlightening and learned a lot. I heard about AAPI and we knew bits and pieces, but you put all those pieces together and explained very beautifully. And you also explained about the challenges and why the organization was formed. So wonderful, and congratulations. And firstly, congratulations becoming the president of AAPI, and also congratulations in advance to you, Dr. Ravi Kolli, for becoming the incoming president. And Dr. Anupama, as a president, tell us a little bit about your tenure before I jump into the main discussion.
Yeah, it's going great. So AAPI is a 501(c)(3) nonprofit organization. So our motto is mostly get the physicians of Indian origin come together, network, and as well as we do a lot of activities for members. So mostly we do CME activities, and also we have philanthropic activities. We have to connect to our policymakers, legislators. So we have a unique program called Latte with Legislators. So where
Wow.
we invite one legislator every other Sunday. We have a webinar. So and COVID, especially last 2 years, COVID, you all know how COVID has affected us. And so physicians, they are like warriors basically. So we served the sickest of our patients globally, actually, not only in US but also in India. We did some consultancies and advices we have given to the physicians in India when they were clueless when the Delta wave was killing a lot of people. And apart from these, we have started some initiatives in India, which is a Adopt a Village program. So every year we take up a project under this Adopt a Village program. So we want to also serve our Janmabhoomi is India, Karma Bhoomi is in United States. So we
Absolutely.
like to serve both the countries. And so for India, this year we started a Adopt a Village Rural Health Initiative program. We did camps and rural for especially all these diseases, which are the killer diseases, silent diseases like diabetes, hypertension, and
Mhm.
kidney disease. So the rural population, interestingly, 38 to 40% don't even know they have diabetes or heart disease or high cholesterol. So this was a very useful project. We are trying to work with the Indian government to see how prevention is better than cure. That's our theme for the entire year. We want to focus more on the preventive care rather than the disease care. So
Wonderful.
change our attitude. If we focus more on the preventive care, probably we can control the disease at an early stage. So that's our goal and theme for this year. All year we have been working.
Beautiful,
So
beautiful, beautiful.
we even recently had a global health summit in India where we focused more.
I'm coming there. I'm coming there. I was about to ask you. So because you mentioned about the Global Healthcare Summit, and because we're calling this topic the our show name as past, present, and future of API. I will talk about just the recent past, and I'll ask you both. How it went. Tell us about this recent Global Healthcare Summit in Hyderabad, what it is all about, and give us your, what were your proactive initiative sequences, and because we were hit big time with COVID since 2020 March, what did you do about the COVID relief?
So when COVID hit India, the Delta wave in March, April, and May, so we raised funds and close to $5 million, and we supported them with oxygen concentrators and ventilators, and we are still continuing the COVID relief work even today, giving them the proper equipment so that way they are prepared for another wave, fourth wave or fifth wave. So we are supporting them with still ventilators and also lab equipment and ICU equipment so that they are prepared for these sickest patients when they get admitted with COVID. And also the Adopt a Village project we are doing right now is to support the rural health, and by emphasizing that prevention is better than the cure. So by detecting these diseases, so we can prevent the disease going into a later stage. And especially diabetes is so rampant in India. Every 5 or 6 are having diabetes right now in India. So I think there is a need to say that this can be prevented by controlling, by frequent checkups with the doctors. Like, so prevention guidelines are not there yet in India. So we recently submitted a letter to the Prime Minister Modi about forming the guidelines preventive Indian preventive task force. So we are trying to work with the Indian government, how we can help them with these guidelines. So all that we do for India is more education and emphasizing on the preventive.
Thank you so much, Dr. Anupama. That was a nice discussion. And jumping into the future, let's talk to our incoming president, Dr. Ravi. Tell us your vision. What's happening with you now? What are your contributions, and what are your plans for the future? How did you plan your future tenure? What are your visions?
Yeah, good evening, good morning. Dr. Ravi Kohli here. I'm the president-elect of AAPI. I'll be taking over the presidency of AAPI in San Antonio, where the next convention will be held from June 23 to 26th. And a lot of initiatives have been started this year by Dr. Anupama, the current president, and I'm going to continue and to their conclusion. To commemorate the 75th anniversary of India's independence, she wanted to do 75 Adopt a Village program and 75 blood donation drives in USA. So we are halfway there, and we still have a few months in her term, and I will continue the same programs and initiatives. And I'm also a psychiatrist, so my emphasis will be mental health as well as physician wellness. Those are the two elements that have been taken a big hit lately, not only due to the pandemic, as well as overall stigma for mental health and reluctance to seek mental health treatment in time. And so I want to focus on kind of eliminating the stigma, improving the access and willingness to seek help, both by the patients here as well as in India, because stigma is even evident here and even bigger in India. And then coming to the physician wellness, physician burnout or physician exhaustion, emotional exhaustion has increased in the last 2 years. And close to 300 to 400 physicians commit suicide in America itself. And every 42nd, one person commits suicide across the globe. So these are staggering numbers. I want to bring attention to these sad statistics and do something about it, both preventively as well as treatment-wise. So those are some of the things we're planning to do. Like Dr. Anupama mentioned, our Global Health Summit was just concluded in January, and we have about more than 50 delegates come from here, in spite of the pandemic, in spite of all the travel restrictions we had. And of course, we interacted with some policymakers and some movers and shakers in India, from Delhi, from academic institutions, as well as deans and all those. We brought medical students from all over the country to interact with them, to inspire them, to educate them. And also we conducted Medical Jeopardy, and our young physicians designed the Young Medical Jeopardy program. And we gave prizes to medical groups, student groups. And we also conducted research seminars and poster presentations to encourage research. Research in India is somewhat lacking. We want to grab their attention early in their career. And we were able to interact and project those needs and kind of inspire our young physicians, aspiring physicians. And those are some of the things. And also, I think Dr. Anupama forgot to mention about HPV vaccination drive she initiated in India, to especially HPV, the human papilloma virus, causes cancer of the cervix, and it's a preventable cancer. It's only one of the preventable cancer with a vaccination. If you vaccinate girls from ages 9 to 13 and 15, and even boys, you can prevent cancer of penis and cancer of the cervix. So she initiated that program, and we launched that as well. So these are some of the things that have been recently done, and we are aspiring to do in the future as well.
Wonderful, Dr. Ravi. It sounds like a great plan, and your vision is beautiful. Wishing you all the success, for the future, and your current plans as well. So, jumping into the next question, Dr. Anupama, tell us about AAPI's, main initiatives, contributions for, people and the NRI community at large. And it's a two-part question. I wanted to ask about your contribution in India also?
To the community, we do some outreach programs, and mostly community should understand the education. Health education is very important. South Asians especially are very much prone to, coronary heart disease and heart attacks, and how our Indian subpopulation die very early with heart attacks. So we as a community are very much prone to coronary artery disease. So we are doing some community health outreach TV programs, so that way it reaches to the community. So that's one thing, and especially diabetes is one, and another major disease in the Indian subpopulation. So I think education is very important, and people should know. And lifestyle medicine, which is something which teaches you how to modify your lifestyle habits and all. So we are promoting more about lifestyle modifications as well. So what exactly is lifestyle medicine? They teach is about 6 pillars of lifestyle medicine, which includes that, one should get adequate sleep and exercise and diet, moderate diet, be cautious about what we eat, daily diet. And also social connectivity is very important, because stress levels are going up because of COVID or whatever reasons we are going through. So social connectivity is very much important. And also the other things which can modify your habits, so like smoking, alcohol, these are another things, these are the things which escalate the problem what we have inside. So these 6 pillars of lifestyle medicine, this is what we want to communicate with the communities, so that they learn and change their habits, so that way we lead to the healthy. So health is wealth. That's what which is very important. Everyone should know about it. If we are healthy only, then you can make more wealth. And also disease is something bad. So why should we focus our on disease curing? We need to focus our energies more on preventive part of it. So this is what our message to the community as well, that change your lifestyle habits and stay healthy.
Wonderful, wonderful, wonderful. Great initiatives, for the community. A lot of people look for, help, and you guys are rendering beautiful help. I commend AAPI for that. I have one uncanny thing to ask. I just read somewhere that AAPI have taken steps in, pharmaceuticals and lawmakers to help regulate and lead efforts with best healthcare practices. I think for everybody in USA, how is this confluence going, and why are you melding pharmaceutical companies and lawmakers? It sounded very interesting to me, so thought of asking you. Throw some light, please.
The pharmaceutical, we are physician organization, so we are mutually, connected with the pharmaceutical. They develop new drugs, and they want to put them in the market. Before they put them in the market, they do all these trials, and also sometimes physicians are involved in these trials. And then once the drug is proven it's successful, then it goes into the market. So physicians are very much doing research, involved in the research. So AAPI is, would like to participate in the research trials. So we have a convention coming up in San Antonio in June. This is our annual convention. Last 2 years we were compromised because of the COVID, but this year we are very aggressive and planning a wonderful annual convention where more than 1,000 doctors will be attending in San Antonio, Texas. So we have various pharmaceutical companies who will be doing their product theaters. Any new drug they have, they would like to present it to the physicians. So we have Medtronic, Pfizer, and Eli Lilly, and Janssen, and Abiomed. So there are so many pharmaceutical companies who have come up with new medications for various diseases. So this is a very good opportunity for them to showcase their product to the physicians. So as we know that Indian physicians, almost like 1 in 7 patients is managed by an Indian doctor. So that's where our strength is. So we know what our strengths are. So they look at that. And the convention is something we change the leadership. So Dr. Ravi Kohli will be taking as a new president in San Antonio Convention. We are looking forward for that. The second question is about the legislators. Yes, AAPI is, healthcare is, we know that our healthcare system is broken, and we want to bring some changes, some reforms in the healthcare, which is good for physicians and communities also. So there are a lot of, roles here, like, insurance companies and hospitals and physicians and patients. So everyone has to play their role well to make the health system very good for us. So AAPI doctors, we connect to the legislators and we present what are the current issues going on, like discrepancy, racial discrimination, and drug costs going up, or, residencies. Our Indian physicians are looking for a green card backlogs, which is a constant problem for us, not getting green card, so that, these physicians have to go back to their countries, or children have to go on a F1 visa, a student visa, unfortunately, even though they are born here. But these are some of the issues, burning issues for physicians, not only for Indian physicians. So by connecting to our legislators, policy makers, I think we can address better, and we can bring some reforms in the healthcare.
Wonderful, wonderful.
And Ravi can add if if I missed anything.
Why not?
Yeah, no, you covered a lot of things. Like Anupama said, prevention is better than cure, and South Asian heart disease risk is very high. We have physicians, so we have a task force, an ad hoc committee working on increasing funding for South Asian heart disease. This is an act proposed by Pramila Jaipal, the congresswoman, called Act 3131. It has passed the Congress. We're now pushing it to be passed in the Senate. And during recent conversation with Senator Durbin, the second highest senator in the Democratic Party, we brought it up, and he was very interested in promoting that act. So we can get more funding for South Asian heart disease research and prevention and treatment. And another initiative many of our members have taken is salt labeling, salt restriction in foods. Food labeling, how to eliminate excess salt consumption, which is a root cause of many problems, especially in the minority communities as well as Indian communities. So many of our members spend their own money, time, and resources to educate a lot of Black churches. They go there, they give blood pressure cuffs and blood pressure monitoring devices to educate them about salt and how it affects their health. So these are individual initiatives that members are taken, and AAPI has also kind of promoted those concepts and preventive activities. And then I think some other things we're doing is, again, serving the poor. We're serving communities with blankets in the winter time during this winter time of the year. We also serve dinners and lunches for nurses who are in the front line in various hospitals across the country. We do some outreach like that. And we are interacting with legislators. We had an interaction with Senator Durbin, Congressman Danny Davis, one of the senior congressmen, and recently Congressman from Alaska came to us, and Marie Newman came to our webinar. So we are reaching out to a lot of congressmen and congresswomen to impress upon them the need for equity, access, and as well as mental health reforms, insurance reforms, prevention, and also the H1 visa backlog. We're all focusing on all these aspects. So we can kind of, not only we're protecting the interests of the doctors, we're also trying to protect the patient's health and public health by policies and advocacies.
Thank you for adding more points, Dr. Ravi. So now I'm coming to our topic, past, present, and future, to the future of AAPI, and talking about the recent future, which is the big event, the D-Day of AAPI in the 40th annual convention in San Antonio, Texas, in June. Tell us about their objectives and the programs that are being planned. What is going to be what are the takeaways for all? Give us a picture of what's exactly going to happen in the 40th annual convention.
Thank you. Definitely, Sharath. So AAPI convention, we are planning from June 23rd to 26th in San Antonio, Texas. And this is the 40th annual convention. And interestingly, we are also celebrating 75 years of India's independence. So the Indian Embassy, Indian Embassy is and US Consulate, they are all helping us. So we are doing some collaborative activities at this convention. So convention usually is basically we like to network and so we conduct CMEs, educational activities, and there will be also product theaters for the pharmaceuticals. We have exhibitors booths and for financial or pharmaceutical or clothing, jewelry and all. So it's a 2.5 exciting events. Every day we have jam-packed events. And we also are planning a very unique program this year, a town hall meeting with India, US healthcare partnerships. So we are inviting the Health Minister of India, Mansukh Lal Mandavia, and Jay Shankar, Foreign Affairs Minister, and a few dignitaries from India. And also from US, we are inviting several India caucus legislators for this partnership. And most importantly, our invited guests are all from AMA to, so all the healthcare leadership and legislative leadership from Texas and US. So you might have heard Dr. Peter Hotez. He developed a vaccine recently, a very low cost vaccine. It costs only $1 or $2 to make that vaccine, which will be prepared in India and supplied in millions to rest of the world. This is a collaboration going with Peter Hotez in India, and he's one of our invited guests. So we are excited to have these important guests, and probably, hopefully, Dr. Soumya Swaminathan from WHO might be there. So hopefully we have a very productive conference, and we look forward for all the physicians who are listening to this Mana TV program today. You can come to San Antonio and enjoy the convention. And evening, we do some recreational activity for physicians to relax. So we have some Indian folklore coming from India because of the 75 years of India's independence. So we are doing an India Day, and some little Bollywood entertainment will be there for the evenings as well.
Wonderful, wonderful. Sounds like a brilliant plan, Anupama. I would love to come there. When you said Bollywood, there are a lot of things which you have, laid out. I'm very sure all the doctors and, our Mana TV, international Mana TV audience, will be very much interested. Thanks for, explaining in detail, elucidating, all the important things which are going to happen in the 40th annual convention. So, so friends, this is your chance. Now that this is going to happen in San Antonio, Texas. Book your flights. Fly or drive to San Antonio, Texas in June, and have a productive time. So how many days is going to be? One day, or what date it is? Can you tell us anything about?
We start on the 23rd June, and then we finish on 26th of June, Sunday. So it's from Thursday to Sunday.
Thursday to Sunday. Wonderful.
Yeah, Sharath, if I may, usually every year we have an annual convention. It's like a business meeting as well as a celebration and a social meeting, as well as educational, continuing medical education meeting. It's a flagship event for the president. She usually does it, or he does it, in their hometown where she has a team. As a matter of fact, Anupama is from San Antonio. She is one of the 4 female presidents of AAPI among the 40 presidents. Wow. So 3 cheers to her. And she has done a fabulous job. And I'll be taking over at San Antonio. And we'll be celebrating, we'll be coming together to collaborate more about future activities. And we will have educational programs, financial seminar, yoga and wellness programs. We have a wellness package offered to the members, and we have yoga experts come and explain. Meditation practices will be explained. Self-care practices will be explained. So there's a lot of things are going on, and it'll be a great event. We request all of you to come, including the media partners, to come and cover.
Right.
So it will be widely projected all over the globe. And it's entertainment part will be there. The food will be fabulous. Indian food will be served, of course, along with Mexican Tex-Mex food. And we have fun things. We have great things in planning. And Anupama is working very hard with the local team, Dr. Jayesha and his colleagues and her colleagues, to kind of make it a successful transition of her president into my term.
Awesome.
Wonderful. I will. I wish you. I mean, my best wishes to you, Dr. Ravi. You're going to take over the presidency in June 2022, and very beautifully you explained, how much fun it is going to be in June. I mean, a lot of positivity. You evoke a lot of positive vibes, both of you, Dr. Anupama and Dr. Ravi. I mean, I can see the excitement in your face. I mean, it's like, it's a cloud9 moment, 40th convention. There's a big convention. So my best wishes for all that is going to happen in June 2022. And so Dr. Anupama and Dr. Ravi, we are almost at the end of the show called The Past, Present, and the Future of AAPI. Before that, I have my last question. Briefly, if you can tell us a little, what are some more projects which are in your pipeline?
So we have the another program we missed to let you know, the childhood obesity. We did a obesity awareness. So this is one big problem now. It's like a endemic problem, but we have initiatives going on with obesity. We do awareness walks. And cancer prevention, we are doing a spring gala in Chicago on April 2nd. So we are doing free mammograms to bring the awareness about breast cancer, because breast cancer is 1 in 5 in women almost now. So those are some of the preventive awareness campaigns we are doing. So AAPI is all about health for community, good health for community. So keeping these in our minds, our focus is mostly to raise awareness of these diseases, which are very common. And education is our main thing. How we can bring reforms is only through education. So this is our future goals. And physician burnout for our physicians, it's our physician community. Physician burnout is another burning issue right now. And like Ravi Kohli is a perfect president next year to address these issues. So that way we can make some projects more focused on how to tackle the physician burnout, like meditation and all these other courses which can do. So we do recreational trips also for physicians. So that way physicians take a break from their busy routines. So we enjoy those trips as well. We do 2 or 3 trips a year, which is something always exciting for our physicians to join and enjoy the little break away from these. So these are various things planned for the future, and I'm so looking forward to give my thing to Ravi Kohli, who is AAPI is in best hands coming years, and so and so.
Absolutely. Anything you want to convey, Dr. Ravi?
No, like I mentioned earlier, Anupama has done a fabulous job, and everybody looks up to her calm demeanor, but steely determination to do things on time, very impactfully. And she does it very kind of dignified and refined way. So I'm planning to continue the same trend, plus add my own touch for reaching out to more people, bringing more people together, and find common causes, and define our goals, and serve with distinction. Bring people together is my goal. And connected, like social connection is so important. Being an AAPI member, you're connected with 13,000 members, 120 chapters, every alumni, every specialty, every region is covered. If you come to AAPI, it's like a home, coming back to home. And it really reinvigorates your mindset, your attitude. You feel refreshed. Every time you go to a AAPI meeting, you come back really refreshed. That feeling is undefinable and irreplaceable. So I wish all the physicians who are for Indian origin who are not members to become members. You'll really enjoy it. You'll really benefit from it.
Wonderful, wonderful. Great message, Dr. Ravi. So, it was a great discussion with both of you, and it was fun, when time just flew. And we discussed wonderful points about, I learned a lot more about AAPI today and your contributions for NRI community, and how we have melded pharmaceuticals and lawmakers, and learning about the 40th annual convention was, it felt really nice, and all of our global audience are watching, whoever are in the United States, just now, Dr. Anupama and Dr. Ravi have invited you all. So here's your chance. And it was fun, and it was it was significant discussion, both of you, Dr. Anupama and Dr. Ravi. So I want both of you to give, closing message to our global audience. Anything you want to convey to Mana TV international audience, to the doctors, or, all the people, the viewers, what is your message?
Yeah. So our goal as physicians is the well-being of our communities. So if we have a good health, then the community is healthy and the world is healthy. So community well-being is global well-being. So that's all the message is. So, take care of your health, and everything else will follow.
Yeah. Thank you, Sharath and Mana TV, for bringing us all together. The word Mana is like us, right? We're all together.
Yes.
And please project all the positive messages to the public, because public is misinformed many times and inundated with false information. So it's our job as educators, physicians, and media to be responsibly improve the lay people's understanding of health and wellness, prevention and treatments, and not fall prey to some unnecessary or unproven treatments. So we all have to do our job, and we are in together. The pandemic told us that it's a small world. What happens in one place can affect everybody and entire globe. So we all have to work together. Mana means us, and we need to work together. And
absolutely.
Thank you.
Thank you, both of you, Dr. Anupama.
Thank you so much. Thank you, Sharath. And thank you, Mana TV, for bringing a
pleasure is ours. It was a great discussion. Thank you so much. So friends, that was about past, present, and future of AAPI, that is American Association of Physicians of Indian Origin, and we have learned a lot, and especially about the 40th annual convention in San Antonio, Texas, this June, and I hope you all enjoyed. You've taken notes, and you have gained enough informational wealth, and I hope it was educational for you. So write to us at info@manatv.net so that we can know what your pulse and excitement is. Until then, please don't forget to subscribe our YouTube and Facebook channels, Mana TV, and watch us on YUPP TV live streaming. So until then, your host, Sharath.